Hi everyone. In today's presentation, I'm going to talk about what are the factors contributed to the main character disabilities. Let's get started. As you know, Helen Keller and Anne Sullivan are both main characters of the movie The Miracle Worker. Both of them are individuals with special needs, where Helen Keller is deaf and blind since 18 months old and Anne Sullivan suffers visual impairment due to trachoma. So, what are actually the factors that contributed to deaf blindness and visual impairment? Deaf blindness. Deaf blindness is defined as a combination of sight and hearing loss that affects a person's ability to communicate, access information, and get around. There are many factors that can be attributed to causing deaf blindness. Varying degrees of vision and hearing loss may occur during pregnancy. A woman may encounter a virus or disease that affects the growing fetus. An inherited condition or syndrome may be passed on to the child. A chromosomal disorder may occur during the fetus' early development. An injury affecting the fetus whilst into utero. Complications during birth. A child may be born prematurely. Neurological conditions as a result of traumatic birth or lack of oxygen. Postnatal or childhood. Inherited conditions that may present during developmental stages. Autoimmune conditions. Illness caused by virus or disease. Injury to the eyes and ears. Acquired brain injury. Young adults to older age. Inherited conditions or syndromes that present later in the person's life. Non-hereditary conditions and syndrome. Autoimmune conditions. Injury to the eyes and ears. Acquired brain injury and the aging process. Visual impairment. A person's experience of visual impairment varies depending upon many different factors. Globally, the leading causes of visual impairment are uncorrected refractive errors, cataract, age-related macular degeneration, glaucoma, diabetic retinopathy, corneal opacity, and trachoma. The main causes of visual impairment were cataract, disorders of choroid and retina, and disorders of the cornea in adults. For adults aged between 18 to 39 years old, the leading cause of visual impairment was hereditary or congenital abnormality, followed by disorders of choroid and retina. The leading causes of visual impairment for adults aged from 40 years old and above were cataracts. Compared with males, females were at lower risk among adults aged 18 to 39, but at higher risk among those aged 65 years old and older. That's all for my presentation today. See you next time. Bye!